So the first thing that you're going to count is your softs. So you always want to start with your softs, and at the hospital, they come like this. You don't want to break this tab until your nurse is ready to count. So if my nurse is ready to count, I would say, all right, let's count. I usually start with my Ratex. So Ratex, you want to count from your hand to the table. You don't want to just go 1, 2, 3. That's not correct, because the nurse also has to see what you're counting. So you want to make sure that she's watching you when you're counting. So Ratex, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 Ratex. Laps, I have 1, 2, 3, 4, 5. Then you can do your softs. So after your softs, it's your sharps or your smalls. I personally don't care which one you do when, but I usually do the sharps, then the smalls, but whichever you want to do. So blades, anytime you're counting something sharp, you want to use a knife handle to point at it. So blades, I have one number 10 blade and I have one number 15 blade. Hypos, I have 1, 2. So I don't have a bovie in this pack. At this point, you would count your bovie tip because it is technically a sharp, okay? You have to show the tip to your nurse. So that would usually lead me into counting my scratch. I don't have one in this pack, but you would count your scratch pad then. Your other small would be your pen, 1, 2, and 3. So 3 pieces. So I have nothing else to count as far as soft, smalls, and sharps. So then I'm ready to go on to my instruments. So you're going to count your stringer first. So you can take your knife handle if you want to help you separate, but you want to look. So mosquitoes, you say the name first and then you count. So mosquito, 1, 2. Cryle, 1, 2. Kelly, 1, 2. Rochester Peen, 1, 2. Alice, 1, 2. Babcock, 1, 2. Coker, 1, 2. This is your Crylwood needle holder. So 1, 2. Mayo Hagar needle holder, 1. Metz scissors curved, 1. Mayo straight, 1. Mayo curved, 1. Right angle, 1. You have penetrating towel clips, 1, 2, 3, 4. Non-penetrating, 1, 2, 3, 4. Forster sponge sticks, 1, 2. So at this point, I could count my knife handles since they're right in my hand. So I'll say a number 3 knife handle 1, number 7 knife handle 1. So then when you get to your retractors and your pickups, you want to count each set together. So if I'm going to start with my pickups, I've got to count all my pickups. So my forceps, I have Adson with teeth 1, Adson plain 1. I have tissue with teeth 1, tissue plain 1. DeBakey, 1, 2. Then I'm going to move to my retractors. So Goulet, 1, 2. Leahy, 1, 2. Richardson, 1, 1, 2 double prong skin hook. I have Army Navy 1, 2. Ribbon, 1, 2. Sin, 1, 2. 1 wheat laner and Gelpy, 1. Did I get the ribbons? Yeah. All right, and I am almost done. So I'm going to count my section 1, 2, and 3 because I have a disposable. So at that point, my count would be done. My nurse would have done my initial count, and then I would make a towel roll for my mayo if I was going to use one, and I would start setting up for my case. You always want to have your case set up when the doctor comes in, but this would end your 20-minute timetable setup.